You've probably heard of a stroke, but have you ever considered that your body might warn you weeks or even a month in advance? Many people ignore subtle symptoms, only to regret it when it's too late. If you notice any of the warning signs I'm about to reveal, don't take them lightly. Seek medical attention immediately. These 7 signs could mean a stroke is on the horizon, and recognizing them in time might just save your life. Symptom number 1, persistently high blood pressure. Chronic hypertension is one of the most dangerous yet overlooked risk factors for stroke. When blood pressure remains elevated, the force exerted on artery walls weakens and damages blood vessels over time, making them more prone to narrowing, rupturing, or forming clots. This damage can lead to 2 types of strokes: hemorrhagic, caused by a ruptured blood vessel in the brain, or ischemic, caused by a blockage that cuts off blood flow. The higher your blood pressure, the greater your risk. That's why managing hypertension is not just important, it's essential. Regular monitoring, lifestyle changes, and proper medical treatment can mean the difference between prevention and a life-altering stroke. Don't ignore persistently high blood pressure. It's your body's alarm bell that something serious could be on the way. Symptom number 2, excessive fatigue. Feeling drained, sluggish, and abnormally exhausted, especially when there's no clear reason, could be more than just everyday tiredness. It might be your body warning you of an impending stroke. This persistent, unexplained fatigue can signal disruptions in blood flow to the brain, often caused by narrowing arteries due to atherosclerosis or the presence of a clot restricting oxygen supply. In some cases, extreme tiredness is an early sign of a transient ischemic attack, TIA, often called a mini-stroke. Unlike a full-blown stroke, a TIA is temporary, with symptoms lasting minutes to hours before disappearing within 24 hours as the body dissolves the clot. However, don't mistake its short duration for harmlessness. A TIA is a flashing red warning that a major stroke could be imminent. Ignoring it could be a deadly mistake. If you're experiencing unusual, persistent fatigue, especially alongside other warning signs, don't wait. Seek medical attention immediately. Symptom number 3, vision problems. If you suddenly experience blurry vision, double vision, difficulty focusing, or any other unexplained eye issues, don't ignore them. Your body might be signaling an impending stroke. These symptoms can indicate circulatory damage in the brain, where restricted blood flow affects the nerves responsible for vision. In many cases, vision loss results from a blocked artery supplying blood to the eye, often linked to an ischemic stroke, the most common type of stroke. While vision problems can have many causes, sudden or persistent changes should never be brushed aside. Taking them seriously and seeking immediate medical evaluation could mean the difference between life and irreversible damage. Symptom number 4, sudden and severe headache. A stroke can sometimes be preceded by an intense, abrupt headache, one unlike anything you've experienced before. While not all headaches signal a stroke, and not all strokes are preceded by headaches, an extremely painful, sudden onset headache should never be ignored. In ischemic strokes, this pain can result from restricted blood flow in the brain, while in hemorrhagic strokes, caused by bleeding in the brain, the headache stems from increased intracranial pressure. Witnesses often report seeing stroke victims clutch their heads in agony before losing consciousness, especially in hemorrhagic cases where the pain is often described as the worst headache of their life. In some instances, this unbearable pain may also indicate the imminent rupture of a brain aneurysm, a life-threatening emergency requiring immediate medical attention. Symptom number 5, numbness or weakness in the extremities. A sudden loss of sensation or strength, particularly on one side of the body, is a major red flag that should never be ignored. This warning sign often occurs during a transient ischemic attack, TIA, a temporary disruption of blood flow to the brain that mimics a stroke but resolves within hours. This numbness or weakness can affect an arm, a leg, or even one side of the face, reducing sensitivity and motor function. While these symptoms may disappear quickly, they indicate an underlying issue that could lead to a full-blown stroke if left unchecked. Whether the cause is a stroke in progress or another neurological condition, immediate medical evaluation is crucial to prevent irreversible damage. Symptom number 6, speech problems. One of the most alarming warning signs of an impending stroke is a sudden difficulty in speaking. This can appear as slurred speech, trouble articulating words, or the inability to form coherent sentences. These difficulties fall under the condition known as aphasia, a neurological impairment that affects speech comprehension, formulation, and expression. If someone suddenly struggles to speak or understand language, even for a short time, it could indicate a disruption in blood flow to the brain. Such symptoms should never be ignored. Seeking immediate medical attention could mean the difference between recovery and permanent damage. 7. Neurological problems. Individuals on the brink of a stroke, whether hemorrhagic or ischemic, may experience a range of neurological symptoms that shouldn't be ignored. These can include sudden memory problems, loss of balance, unexplained nausea, and vomiting. In some cases, these warning signs can appear days or even weeks before a major cerebral event. However, it's important to note that similar symptoms can be caused by other conditions, making diagnosis more complex. Migraines, seizures, hypoglycemia, brain tumors, anxiety attacks, and infections affecting the central nervous system can all mimic stroke-related symptoms. This is why seeking immediate medical evaluation is critical. Only a professional assessment can determine whether these neurological changes are a sign of an impending stroke or another underlying health issue. Preventing a stroke starts with maintaining a healthy lifestyle and managing key risk factors. Keeping your blood pressure under control is one of the most important steps, as hypertension is a leading cause of strokes. Regular exercise, a balanced diet rich in fresh fruits, vegetables, and healthy fats, and avoiding excessive salt, sugar, and processed foods can significantly reduce your risk. If you smoke, consider quitting, as smoking damages blood vessels and increases the likelihood of clot formation. Managing stress, getting enough sleep, and keeping conditions like diabetes and high cholesterol in check are also crucial. Regular medical checkups and early detection of potential issues can make a life-saving difference. Taking these preventive measures can help protect not only your brain, but also your overall health. If you notice any of these warning signs, don't ignore them. Your health and even your life could be at risk. A stroke can strike suddenly, but in many cases, the body sends signals well in advance. Recognizing these early symptoms and seeking medical attention immediately can make all the difference in preventing severe complications or even saving a life. Stay informed, take care of your health, and encourage your loved ones to do the same. If you found this information valuable, be sure to like this video, share it with those who might need it, and subscribe for more important health insights. Your awareness today could prevent a crisis tomorrow. Stay safe, and we'll see you in the next video.